All right, good morning. Well, it's good afternoon. And on this, the 1st of December, I'm joined by Mr. Thami Mtshali, a chemical engineer businessman, and has done very well for himself in technology. And I'm emphasizing technology because we're going to talk something different with him, and that is to do with healthcare. Mr. Thami Mtshali developed Galela oil, which he regards as a super immune booster. And many other people have used it, including the leader of the UDM, General Bantu Holomisa, who's taken to social media to extol the virtues and efficacy of Galela oil. But there are other people who are skeptical when it comes to this particular oil. And it's been touted as a very good therapy against COVID-19. And I know that we've got to be very careful when we start talking about COVID-19, because the debate is still out there on a variety of interventions that are being looked at to reduce the spread of the disease, which has claimed so many lives and, of course, caused damage to so many economies. But Galela oil is a therapy that Thami Mtshali and others who have used it believe is very, very effective antiviral therapy and can help when it comes to COVID-19. Now, we will also be talking to Dr. Pali Lehohla, who has conducted some research to check into these claims of whether Galela oil works. And he's going to talk to people who have used it. And he will be revealing for the first time the results of his research and the studies that he's been conducting around Galela oil. We'll be joined by Mr. Fabricas Kabasha from Tanzania. He's a pharmacist to also talk to us about the efficacy and the makeup of Galela oil. I suppose it's an intellectual, or it's protected via IP, the laws, but he will give us a sense of whether it is toxic or not, because here at home, the health authorities that are supposed to sanction these types of therapies are still skeptical, and Thami will tell us whether he has approached them. And if not, why not? Because he has approached the American authorities, the Food and Drug Agency of the United States, the FDA, and they have given him a certificate of approval in that regard. And of course, we would like to hear from you. If you have used Galela oil, what is your first-hand experience of it? And if you have not, and you are skeptical, or you want to find out more, please do so right away, because we will be putting your questions to the panelists. Gentlemen, good morning, good afternoon, welcome. Thami Mtshali, good morning. Dr. Lehohla, welcome. And Fabricas Kabasha, welcome. Okay, now we can see you. Let me not waste our time. Dr. Lehohla, let me start with you. Oh, why not? Let me go to Thami first. Just a brief background, Thami. I'll come back to you later on. How did you develop Galela oil? Because, you know, we have the COVID-19 problem emerged only last year, at least globally, even though in late 2019 in China. So many people are wondering, how did you know that you should come up with this kind of therapy for this new type of viral infection? As we know, it was even called a novel virus, but you already had a solution for it. So what happened? How did it happen? Is Thami gone? Lost him? Okay, I'll come back to him in a moment. Let me go straight to you, Dr. Lehohla. Claims have been made about the efficacy of Galela oil, and you've gone out to talk to numerous people, professionals, as well as the patients, if one may call them that, or people recovering from COVID-19, and they've had stories to share with you. What are they telling you?
Thank you very much, Dr. Modise. I hope I'm audible.
Yes,
good
you are.
morning to you all. I need to share my screen, and I don't see myself getting rights here. If the organizer can allow me to get rights to share the screen, because I have to present the results of yes, that's good. There we go. I'll share the presentation. I actually wouldn't have gone into this at all. I was approached on our platform, social media platform, and there was a request. I said, well, can you work with us on something? And then I said, but that's not my area of work. And then a round of discussions took place with Mr. Mtshali and then with Professor Melba. And then I said, well, if this is what this thing perhaps is supposed to do, let's drive a tracer study and say what happens to the people who have ingested it. Many will ask questions around sampling frame and how was the sample designed. It wasn't a random sample, it was a list of people who have used the product, and we have to engage them in questions as to what is their experience. So I'll share the screen and I'll go through this presentation very, very quickly. I hope my screen is visible.
Yes, we can see it.
Is it?
Very visible. Yep.
Is my screen visible?
Yes, it is.
Okay, then I'll make sure that I become a little smaller, because now I'm sitting on the screen. I can't see I see a lot of myself there, and I want to make myself a bit smaller so that the screen
we can see it.
I can read the results of the screen.
Yeah, sure. Just go ahead.
There we go. Well, the problem that MD says I don't see. Okay, there is my presentation. I think this is. We went through this in 3 waves. Obviously, these waves tend to correspond with wave 2, wave 3, and probably what is happening now, which might be the 3rd wave. The number of respondents in this, in the first instance, were 47, and in the second instance were 150. Well, predominantly female, less males. And of course, we took another round for about 11 people that we had to interview more recently, from Wednesday last week. So we'll also present just the final results and not the background variables of these ones. So this is the age distribution in round 1, and I've used the terminology round 1, round 2. This is not to scale. That is the graphics on the presentation are not to scale. So you'll see that here at age 30 to 44 is 20 people. And in the second round, age 30 to 44, it's people who are, there are 62 people. So you cannot compare the heights of this and say that's it. So you have to read more the numbers rather than assume that it's to scale. So there were more people in round 2 than there were in round 1. So there have been 233 people up to now that have been spoken to. By racial composition, it's been mainly black, 1 white and 1 colored in the second round, and all black in the 11 that I've spoken to now. The level of education is really people who are professional with degrees and the like. Very few people in primary school and secondary school, in both rounds. There are people with higher education. And of course, in terms of employment status, they are self-employed employees, others are retired. In the first instance, there were students. In this round, no students. In terms of occupation, these people are well, of course, schooled or well educated, and they are professionals in terms of occupations they have and managers in instances. By province, we've got a number of provinces distributed there, but the whole thing was about largely Gauteng and less about other provinces. Gauteng dominated. So the source of information on Galela has been a friend or a family or a Galela agent, particularly family. And in the second round, there's been something that is very interesting in that the majority of the people, 113 of them, did not used Galela for other purposes rather than for COVID, whereas in the round one, wholly the people that we interviewed were using Galela for COVID treatment. Sorry, and of course, COVID infection status, the majority of people, as you will see, 35 in the first instance and 70 had tested positive, had actually presented, not only tested, but presented symptoms that are COVID related and tested and confirmed. These are the number of months in the first round by testing way. This is from about April, or rather people who were infected in April, May, June, and July. And then now in the second round, these people were infected since January 2021, and this one is January 2021. But now we proceeded up to October now in 2021. The symptoms that they presented in both instances are presented there, and those are the absolute numbers of symptoms presented. Lost taste, the dry cough, diarrhea, weakness, and so on, the normal symptoms that we know COVID presents. Now, the key issue then was these people were given or bought Galela and took Galela. Now, these are the dosages that were taken after those round one. And the dosages are presented in terms of they must be taken in the morning and in the evening. So there's one dosage, 4 people took this dosage, one dosage, and 11 took 2 dosages, so in the evening or in the morning, or in the morning and in the evening in round 1, and similarly in round 2. And of course, we see here people took 6 doses, and that's the mode that is the highest number, the highest frequency that took this. And here is 2 doses in the first round, but in the second round is 6 doses, which means in the morning, in the afternoon, in the morning, in the afternoon, and in the morning, in the afternoon. So over a period of 3 days. Now, the part that brings the evidence here is around how do these people feel after a number of days, both in round 1 and round 2. Here we say that within 2 days, the number of people that felt better. But in fact, after 1 hour, after 3 hours, they also felt better. And here we see in round 2, which is with those people that we tested, they felt better after a few hours. And day 1 and day 2, if you look at up to 2 days, there will be 14 people there, which would have made this the mode. And the correspondence of this 2-day period within which relief is felt, that is, those symptoms have dissipated or disappeared, and people are on with their lives. It's what the observations in terms of people who have taken Galela. I took the survey myself, asked these people, so 230 people I spoke to, and some of them were near-death experience. And when they took this and found themselves escaping death, they go on and on and on and on and on and tell you about what was happening step by step. I think death sharpens your mind to the point that every detail counts. One of the people we interviewed was already putting the ATM numbers next to the headboard so that the mother should find them for purposes of burial. And that was happening at about 3 o'clock in the afternoon. Galela was given to her by Dr Mtshali himself. And by 7 o'clock, 6 o'clock, 6:30, we were talking to her. And the mother kept on opening the door to find out what is happening. And we could hear the door as it opens. And she said, my mother is actually trying to find out what has happened to me, because 3 hours ago, I was dying and I was putting pins alone in the room next to the headboard so that if I'm gone, the mother doesn't get trouble. But here I am now talking. She was so noisy. So, but there are many stories of that nature. Now, for the 11 that I talked to from on Saturday actually, and Sunday, one got relief within 3 hours, 2 after 2 hours, and up to 2 days, 8 got relief. And we are continuing to try and find out what the nature of relief is. I ran independently, and I ran this service independently of Galela oil. One of the things that is very interesting is how Galela is delivered, time within which Galela was delivered. In 30 minutes, within an hour, within 3 hours, within 4 to 6 hours. And that is a history of delivery of Galela throughout South Africa. That the logistics, the humaneness embedded in here, very interesting. In one of the interviews, the lady said, well, I didn't have money. And Dr Mtshali said, well, you will pay when you are alive. There is a lot of confidence, therefore, in the product by the people who manufacture it. That, yes, there it is. It's not where is your medical aid first. It's about where is your life first. Your life counts. And I think this particular attitude in terms of delivery, in logistics, and delivery of the medication brings a new notion of Ubuntu into the space. I could tell on and on and on, but that is my story about Galela. One, there is serious coincidence at the rate at which people get relief across all the different time periods I've been doing this study. Looks like 2 days, which means 4 doses of Galela help you. And 4 doses of Galela is 4 small teaspoons in 2 days. That is, within 2 days, you have taken 4 small teaspoons, and then you are back to life. And Dr. Modise, I'll leave it there, sir.
All right. Before you go away, and we will be coming back to you later on when we start taking questions, and let me invite the attendees to share their thoughts or questions so that I can put them to the panelists. But what were your conclusions? I mean, what impressions did you form when you were conducting this survey and interacting with people who were using Galela oil?
Well, it's very difficult. I mean, you come into a space and you see many oils and you see this other oil, and you are invited to come and talk about it, to get to talk to people. You certainly are very, very skeptical. You wouldn't like to do that. There is a serious reputational risk when you do that, especially if you have to present the results like I'm doing now. But I wouldn't have done this had I not had a discussion of a scientific nature with the people that produce it, which is Dr. Mtshali and the late Professor Malbe. And they said, well, we are searching, but there are things in the search that suggest that this works. We may not know the full story about what things drive it. The second thing was that it was approved as a food supplement by FDA, and the CSIR found it to be non-toxic. And in fact, for all people that we have asked what the side effects are, they are none whatsoever. What it does do is that it improves general health, it increases energy, it improves the digestive system, it mitigated flu, it did all the things that the body actually requires more in a natural setting. So these are the kinds of those who are using Galela now, the 112 in the second round, who are using Galela just for maintenance of their lifestyle and health. So this is, so having done this and having had people who were near death experience that you talk to in the one point when they were and the other point when they are not, left me quite amazed. I wouldn't like to preempt what the presentation from the scientific or oncological expectations of this are, because then I'll be eating the thunder. But the correspondence of what it is expected to do and the experience of the people who have ingested it cannot be a coincidence.
Okay, well, Peter Mbolekwa is attending this webinar and has sent us a comment to say, no question really, I would testify to the effectiveness of the Galela immune boosting oil. So that's a message from Peter Mbolekwa. And Bruce, you say you cannot hear us. Well, I'm not sure what the problem could be, but we are okay. Bruce Morgan, I hope you can connect with us. But let's take a look at this video to find out more what the other views are regarding Galela oil.
My name is Professor Leonard Melber. I'm neurologist and I have worked nearly my lifelong scientifically on immune diseases, because immune diseases are the cause of a lot of neurological diseases. I am now emeritus. I have been before as well professor in America, in Boston, in New York, and on several European universities scientifically, and I know the composition of this Galela oil. If I look into the composition scientifically, then I am convinced it's an autoimmunological effect. It is helping the immune system to recover quickly, to build more immune cells to defend the body, to defend enemies who are trying to attack certain cells through the membrane. But this is a very complicated process, but we have looked into it, and it seems that it is protecting the outer membrane of the cell, and that it is removing, or that it is slowing down, minimum slowing down, let me say it in this way, the way of the virus to go inside the nucleus of the cell. And that is helping even to remove and to correct the DNA, desoxyribonukleinsäure acid, that it protects it, and that it is removing the virus which is trying to go inside this DNR and to multiply himself. It has a certain influence outside the cell, on the outer membrane, and inside the cell. Because we made as well certain trials with patients, by example, HIV patients. On HIV patients, you can measure the number of viruses inside the cell. We measured in the laboratory the number of virus inside the cell. And we measured after 1 day, after 3 days, after 7 days, and after 12 days. And we found a significant, not a small, a significant reduction of virus inside the cell. So obviously, this natural product must have a possibility to remove viruses from the inside of the cell to outside, or to kill, present this virus to the macrophages, and the macrophages are eating, I say it as a picture, are eating the virus and are removing it. So that's a significant. We found even it's going down to a level where we cannot measure it anymore. We cannot say, okay, we measure it anymore. So it has as well this function. Now in certain diseases like HIV, we have very good mouse models. These mouse models, and that's presently the big problem in the corona field. For corona, we don't have a mouse model.
Fabrice Kabasha, who is a pharmacist. He's based in Tanzania to talk to us about his impressions of Galela oil. Fabrice, welcome.
Thank you so much, Mr. Modise. I don't know if I'm audible enough.
Yes, we can hear you now. Thank you.
All right. Thank you so much. Thank you so much for this opportunity to share on this platform. I also have a small presentation that I have prepared. If I can be allowed to share the screen, that would be great, so that people can follow as I take them along the pharmacology of Galela oil.
Yeah, go ahead. You can go ahead. Thank you.
Okay. Okay, so can everyone see my screen?
Yes, we can.
All right, thank you very much. So yeah, so my journey with Galela oil actually started when I was working with Professor Melba. I've been with Galela oil since 2019, around 2019, and one of my jobs was to process data, medical data that Professor Melba was working on. I was compiling his research papers, and I was processing the medical data on his research. But of course, I was very curious because I was seeing things that were very mind-blowing, and then I said, okay, this must be very interesting. But let me just take you through the pharmacology of Galela oil, because most people hear Galela oil, others have used Galela oil, others simply know it, they just know it as oil. So they don't understand. We need to understand what kind of oil is this one. Is it a snake oil? Is it engine oil? Is it cooking oil? So my duty today on this presentation is to simply show you how Galela oil is just a pharmaceutical product which was scientifically extracted and processed. Let's just go ahead and go through this presentation. So Galela oil, like I mentioned, the studies on Galela oil were done by Professor Melba extensively and his team. And these studies were conducted in vitro, meaning they were conducted outside the living organism. And most of the time, this is done in test tubes or by computer simulation. So the studies were also conducted in vivo, meaning they were carried out inside the living organism. Most of the times, in our case, it was in mice. The study was conducted in mice. But of course, you need to remember what led these studies being conducted was curiosity, because most people are reporting high efficacy whenever they were taking Galela for different reasons. So yes, human beings were also used as subject of scientific observations and deductions for scientific reasons. So I will go ahead and talk about Galela oil now as a pharmaceutical product, because given the kind of controversy surrounding Galela oil, or the kind of myths or beliefs or talk or gossip around Galela oil, some people believe it to be like just another sangoma concoction. Others believe it to be another snake oil that does not work. But you see, in science, you have to prove everything. In science, you have to test everything, and everything has to be evidence-based. So what is Galela oil exactly as a pharmaceutical product? So Galela oil, we abbreviate it as GO most of the time. So whenever you see GO, just now I'm talking about Galela oil. This oil did not fall from heaven. It's not made from some mysterious or some mystical stuff that we cannot know. Okay, the active ingredients was scientifically extracted from medicinal plants, and I'm underlining scientifically extracted because this was done by a chemical engineer, Mr. Thami Mtshali. So he knew exactly what he was doing, and he knows the process of extracting these materials. So they were extracted from medicinal plants. Medicinal plants means most of these plants have been used before, and the active ingredients are known. They have been used in other preparations, in conventional medications. because we know that most of these drugs we take actually are extracted from plants, from trees, plants, roots, leaves, depending on whatever kind of efficacy you're looking for. So these plants have been used before. So because they have been used before, we can study Galela oil and we can actually know what Galela oil is made of, the active ingredients. So the pharmacology of Galela oil can and has been studied before. All right. I will go ahead and speak about pharmacokinetics of this product. Now, pharmacokinetics simply, I think, for those of us who are not in the medical profession, is a fancy word that means effects of the body on the drug. So there are effects of the drug on the body. That one is called pharmacodynamics. But pharmacokinetics here means once you have taken this product, what does your body do to this drug once it's in the system? So the chemical composition that we have established, of course, they are from medicinal plants. But now, when they come together, they make a Galela compound, a lipophilic compound. So let me just give a setback quickly, and I want to discuss lipophilicity and hydrophilicity so that we can refer together. When we say lipophilic compound, what does it mean, and how does that influence the way Galela oil works? Now, efficacy of a drug depends on its ability to dissolve in body fluids and fatty structures. The fatty structures of the body. We're talking about plasma, extracellular fluids, intracellular fluids, and the biological membranes. Now, I want you to underline that word, biological membranes, because we will come back to it most of the times. Now, drugs that dissolve better in lipid environment, they are called lipophilic or fat-loving products. Okay, so those ones that dissolve quickly in water environment, they are called hydrophilic. That's what we are calling hydrophilicity up here. So the hydrophilic products are absorbed very quickly in the body. The metabolism is very fast, and the elimination from the system is also fast. Why? Because we all know our body is something like 75% water. So that means any product which is water-loving or hydrophilic will be absorbed very quickly, and metabolism will be very quick. Okay, I can give an example of alcohol. When you take alcohol, depending on what you are taking, of course, because I know some people take some dangerous stuff which can only be close to aviation fuel. But if you take normal alcohol, your body, because it's a hydrophilic product, your body is going to absorb it very fast, and you will not be drunk for 2 months. You will be drunk for some time. When you wake up in the morning, you will simply have a hangover, but probably alcohol will have been eliminated from your system, because that's how hydrophilic products behave. But for lipophilic now, like Galela oil, absorption is very slow, but they are very able to permeate or penetrate through biological membranes. Okay. Now, when they are permeating or penetrating through biological membranes, it means bioavailability is good. I'm going to define what bioavailability is down here. So bioavailability simply means the concentration of a product in the system after absorption. And that is one of the first factors, pharmacological factors, that leads to Galela oil becoming very effective. So bioavailability of Galela oil, according to studies, have been seen to be about 11%. Now, what does 11% mean? I want you to understand that once you take a medication by injection, that medication goes straight in the blood. So bioavailability, because the blood concentration is immediate, bioavailability is 100%. But once you take it through your mouth, bioavailability, of course, it has to go through the stomach, and then it goes to the liver for metabolism. So bioavailability is very slow. The concentration is very slow. Most of the drugs, the bioavailability is only something like 3%, 2%, 6% at most. But for Galela oil, according to what has been observed, it goes up to 11%, which means it's a very good product with high concentration. Now, factor number 2 for pharmacological effect and efficacy is lipophilicity or permeability in biological membranes. Again, Gallela oil has the ability to enter and penetrate in these membranes. Okay, so if you take Gallela oil, it passes very quickly in these lipid membranes. Okay, I keep repeating the membranes because when we discuss COVID-19, you will see why most patients who have COVID-19 actually recover very quickly or report quick recovery. So we will get to that in a few seconds. So Gallela oil, we have high concentration in areas like bronchial mucosa, for example, if you're looking at my screen, bronchial mucosa or the vocal cords, endometrium. People who, I remember there's a lady who gave a testimonial that she used to have this severe pain whenever she was menstruating, and then when she took Gallela oil, the thing disappeared. But now I want you to look at this. It has high concentration in places like endometrium mucosa or mucosa of the uterus. Esophageal mucosa, there's also high concentration. Gastric mucosa, there's high concentration. Olfactory mucosa, penile mucosa. Now here, let me just pause a bit because there's a study that Professor Melba conducted on erectile dysfunction. Actually, people who were suffering from erectile dysfunction and took Gallela oil, after I think it was about a week or two, they started reporting very good results. So this is why we are reporting that it penetrates very well in the penile mucosa and the vaginal mucosa as well, and the anal canal. So wherever you have lipid membranes, Gallela oil will be very able to penetrate very easily. Okay, let's go to the next item here. And this is factor number 3. For a drug to be very effective, there's something called the blood-brain barrier or the blood-brain threshold. We abbreviate it as the BBB, the 3 Bs. So now what is the BBB? BBB is a layer that protects the brain from harmful substances. So most of the drugs, they remain in the blood circulation and do not cross this BBB to enter. Okay, that's what happens to most of the drugs. But for Gallela oil now, Gallela oil has been seen to cross this BBB, and any drug that can cross this BBB will have impact on the regulatory system of the brain. We are talking about thermoregulation. There's a study that was conducted on thermoregulation effects of Gallela oil. We're talking about salivation. We're talking about micturition. Micturition is a fancy word for urination, you know, the process of urination. So cardiac function, muscle contractions, those are the regulatory, some of the regulatory effects of Gallela oil once it has crossed the blood-brain barrier. Now, also it will influence how neurotransmitters work. Neurotransmitters, we're talking about substances like acetylcholine, we're talking about serotonin, noradrenaline, or dopamine. Now, what do these things do? These things, they transmit signals. They are called neurotransmitters because they transmit the signals from the brain to the rest of the body. Okay. Now, when neurotransmission, when signal transmission is very good, you will experience pain very fast. Okay, because if the neurotransmitters are not working properly and the signal transmission is interfered with, someone can just disturb you in the morning and you feel it in the afternoon because there's delayed response. Okay, maybe that's an exaggeration, not in the afternoon really, but there could be a delayed response in the way you transmit this information from the brain to the area which is involved in pain. So signal transmission for pain, reflexes, and normal reaction potentiation. That is what a drug that crosses the blood-brain barrier is able to do. And Gallela oil can do exactly that. So what are the effects or the benefits of Gallela oil once it has gone in the brain? We have seen so many patients reporting, thermoregulation, of course, is one of them, regulating the temperature of the body. Seizure, the Gallela oil has been able to treat some seizure patients. Seizures, those are epileptic patients. Pain relief, migraines, hypertension, the gastrointestinal ulcers. Actually, this is one of the things. This is one of the reasons the maker of Galela oil did it, because of ulceration and erectile dysfunction. We mentioned parasitic infections like malaria and many more.
Well, now that we don't have Prof. Melbe presenting and Fabrice disappeared, I thought I could just add one or two points around this, especially when we're discussing what Fabrice is talking about, which I know very little or nothing about, whereby many people say, what is the magic? And I remember in a discussion that we held with Tani and Professor Mebe, and Tani said, well, what is the miracle in this? Professor Mebe said, everything has to be explained. We may not know everything, but it has to be explained, because Galela oil has these properties that should be explainable in science, observable and explainable in science. And I think the research work that is continuing is very promising. The depth of science in what is going on is very encouraging.
Let me look at the comments now. We have welcome Sandawa and Velas saying, in July I was bedridden. Thami sent the major Galela oil and it saved me, and would like to express gratitude for that. We also heard from, okay, who else has been commenting here? I'll tell you. I'll come back to the comments. I think let me talk to Thami Mtshali to just give me a brief background, if Thami is there, so you can join us. Thami, I hope you can hear me. I'm very curious to find out how you embarked on the Galela oil journey. Here we are today, we're sitting with a major problem in the world of COVID-19. We are told that it might help, it might boost our immune system, but how did you develop it? Obviously, as you told me privately, that it was not meant for COVID-19 when the journey first started. Tell me more. Again, let's unmute your microphone there. We cannot hear you.
I suffered from ulcerative colitis, and my daughter suffered from Crohn's disease. These are all very hectic ulcers that stops your life from moving forward, because you need a toilet all the time. And I went to several hospitals, and at that time I was still in the top management of IBEST, so it destabilized me even at work. So I would spend at least 15 to 20 days every year at hospitals, and nothing was found. Well, nothing was sorted. And I would not even sleep the whole night for many days. I can even tell you what time the first bed starts singing in the morning, around 3:15 in the morning, because and I could look at my daughter also hopelessly, without knowing how we are going to sort out this whole problem. Until I decided then to say, let me do my own research. I'm going to do some extraction of oils from seeds and from plants. And after the extraction, and me and my daughter got better, our medical aid bill went down from 30,000 rands a month to 8,000 rands a month, because we did not longer need the expensive medication for our ulcerative colitis and also for the Crohn's disease. So this is how this was developed. And my mother and her friends kept on asking for this much and this much and this much. Before I realized, I started running out of containers in the house. And then and I was forced to go and buy bottles. I started buying bottles, and people were not enough that I bought the bottles. They said, what's inside the bottle? This is when I had to develop the label. It took me over a year to develop a label, because I also didn't know how to describe what was inside. So I worked very close with Professor Melba to describe what was inside. And as we described what was inside, we then discovered that for HIV patients, within a month, we were able to drop the viral load from millions to less than 20. And were able to increase the CD4 count from one patient had less than 70 CD4 count. After 2 weeks of Galela, that number went all the way up to almost 400. And she started gaining weight. She started looking very pretty. And so this is what poked our curiosity, because HIV is autoimmune disease. Your cells do replicate. And when SARS came, it was almost similar situation to say, if SARS behaved like HIV, we should be able to stop SARS from replicating inside the body, which is what we are doing precisely with COVID right now. It doesn't matter whether it's beta variants, alpha variants, and these variants. We don't use the spike protein to identify the virus. We use a holistic nature so that we're able to see the virus coming from far, as you heard from Fabricas. Funny enough, your messenger RNA also has 4 lipids. Your messenger RNA that you find in your vaccines, it has 4 lipids that they use to transport the spike protein into your cell. So when Fabricas was talking about lipophilic, even the current technologies of Moderna, Pfizer, they are also using the same lipids to transport
Let me interrupt you there, Thami, partly because of time. You know, we may overrun by a few minutes, but I have to ask this question. It's got to do with the South African Health Products Regulatory Authority, you see, and the question is, why have they not cleared this product, or why have you not taken it to them to endorse or to test the claims that are being made about Galela oil?
Okay. From my technology side, when I approach regulator, I usually look for the path of the least resistance so that I can start producing and selling. We have applied for the, we are going through the process of registering the product with SAPRA. I think we should be done by within the first quarter or second quarter next year. The reason why FDA was quicker, their processes are less laborious compared to the SAPRA processes. But we are following the processes of SAPRA to register the product here in South Africa.
FDA is the United States agency, right? What does that mean? That you are allowed to export it into the American markets? And has there been any take-up on the part of the Americans and other people around the world?
We're delivering next week 10,000 bottles to Amazon. They also requested the FDA registration. And because of the FDA registration, we won't have any problem with custom duties to clear the product at customs in the USA. We have shipped the product to the USA several times already before. In fact, some of the witnesses are going to be coming from, I think 1 or 2 are coming from the USA in Atlanta, who has used the product for COVID in the USA.
Who generally uses Galela oil in South Africa? Are there any professional people in the medical field who may have used it and can testify to the efficacy of Galela oil?
Yes, we have treated doctors, and my younger brother is a medical doctor too. And Dr. Zakwe treated several patients, including pregnant ladies, because she had no other solution because those were two people that were infected, the baby and the mother. So we do have a series of medical doctors using Galela.
Any prominent people? You may not want to disclose their names. I've heard of some of top personalities in South Africa and those in government. We're told are actually using it. And I'll tell you why I'm asking the question, because if influential people are using it and some of them are in positions of authority, question is, why are they not coming out and speaking for Galela oil or pushing for it to be made available to the general public? Because as we can imagine, people are anxious, people very concerned, and many have lost loved ones. And they will be very upset if Galela oil works to know that there was a solution all along, but it was never made available to the people.
You can understand, Tim. We also have to go through what we call a normal research and development. When we started talking with Professor Pali Lehohla, we wanted to quantify to see whether can we put numbers into this remedy independent of Galela itself. So in your pharmaceutical, they normally say you go through your clinical trials where you take these to real people and then you analyze the number of people that way. So before then, we could not have gone to the government to say, here's our study and here's what it says. So we needed to work on our studies and be able to get to this far to say, amongst X number of people that were interviewed, it worked on several other people. So I think that will be the process going from now on to the government to say, let's work together now, because we also want to contribute to stopping the number of deaths in the country, but we also want to stop the lockdowns. We also want to stop the economy from deteriorating. As you heard from Professor, he said 2 to 3 days people feel relieved. In 30 minutes to 2 hours, people feel relieved. So if that's the solution we have in the country, we don't have to go through any lockdowns, and because we are able to treat, and we are not going to have flooded hospitals. So we will take this exercise, this project forward with the government, because we really want to assist the South African economy and the South African people, not to die, but the economy to recover very fast.
Are there any people in positions of authority who are sympathetic or who are understanding of what is developing around Galela oil?
Yes, okay, I can mention Pam Mtshali, Minister Pam Mtshali. I can mention I can mention who else? I think I had Gwede also took Galela when he was sick. And I also had, Jeff Hatebe also takes Galela, and I hope I'm not going to be in trouble to mention also the Minister of Finance, yes.
The current Minister of Finance?
Yes.
That is Minister Kodongwana, am I correct?
Yes. It took Galela way before there was COVID.
Okay, so and he's still taking it. That's what you mean, yeah. I suppose.
Yes.
Right. People want to know where they can buy it. Roger Dawson and Robert Humphreys. I hope I pronounced the name right. But say, where can they buy it? Where can they get it?
We have a call center. You call the call center 011 1302. 011 1302. We take your order, we deliver within less than 2 hours.
Thami Mtshali, thank you very much for sharing with us the Galela oil story. And we tried, and I must apologize to the attendees for some of the breakups that we had and the connectivity issues and so on. I know that in your time in technology with iBurst, that was one other problem that we were trying to solve. And one would have thought that it is completely sorted out by now, but there we are. You know, this thing is, it's a stop-start type of situation. But thanks again for taking this story to the broader public. We appreciate.
You're welcome.
Thami Mtshali, who was joining us to talk about his product, Galela oil, and Dr Pali Lehohla, who did a study, conducted a study, spoke to people who had used it and found that majority of them had their conditions improve post COVID-19 infections. There are still a couple of outstanding issues still to be sorted out with, for instance, the South African Health Products Regulatory Authority. So once again, we'll have to wait and hear what they say. But we're told that in the United States, the Food and Drug Agency there has already approved Galela oil. And Fabrice Kabasha, who joined us from Tanzania, thank you very much for your presentation as well as your contribution to this discussion. Thank you, and thanks to the attendees. Dudu, thank you very much. Have a great day.
Thank you. Thank you.
Yeah.